As children, they have difficulty in walking. As teenagers, most require wheelchairs. Their average lifespan is less than 30 years old. What devastating disease do these people have? By the way, my name is Asnia Mostapa. Join me in this episode where we will discuss one of the most debilitating diseases, which is the muscular dystrophy. So, what is muscular dystrophy? Muscular dystrophy refers to a group of more than 30 genetic diseases that cause progressive weakness and degeneration of skeletal muscles used during voluntary movement. The word dystrophy is derived from the Greek words "dys", which means difficult or faulty, and "troph" means nourish. These disorders vary in age of onset, severity, and pattern of affected muscles. And also, muscular dystrophy is an inherited disorder, which means that it is passed down from parents to the children. It can be inherited in an autosomal dominant or autosomal recessive pattern, depending on the specific type of muscular dystrophy. So, how the muscular dystrophy progress? What is the mechanism of it? The muscle fiber membrane contains a group of proteins called the dystrophin glycoprotein complex, which prevents damage as muscle fibers contract and relax. But when this protective membrane is damaged, muscle fibers begin to leak the protein creatine kinase and take on excess calcium, which causes further harm. Take note, creatine kinase needed for the chemical reaction that produces energy for muscle contraction. Affected muscle fibers eventually die from this damage, leading to progressive muscle degeneration. So, for us to know if someone has a muscular dystrophy, we need to know the symptoms of it. Through symptoms, we are able to know if a person have this kind of disease. The symptoms can vary depending on the specific type of muscular dystrophy, but there are some common symptoms. The first one is the muscle weakness. This is the primary symptom of muscular dystrophy. It typically starts in the muscles closest to the center of the body, such as the hips, pelvis, thighs, and shoulders, and then progresses to the other muscles over time. So, let's proceed to the second one, difficulty walking. As the disease progresses, individuals with this kind of disease may experience difficulty walking or have an abnormal gait. They may also have trouble getting up from a seated or lying position. The third one is muscle stiffness or joint contractures. Some types of muscular dystrophy can cause muscle stiffness or joint contractures, which, which can limit the range of motion and affect the joints. The fourth one is muscle wasting. Over time, the muscles affected by muscular dystrophy may become smaller and weaker due to the generation of muscle fibers. The fifth one, delayed motor milestone. Of course, in some cases, children with muscular dystrophy may experience delays in reaching motor milestone, such as sitting up, crawling, or walking. The sixth one, breathing difficulties. Muscular dystrophy can affect the muscles involved in breathing, leading to respiratory problems and difficulty breathing, especially during sleep, which is terrifying, right? The last but not the least, cardiac issues. Certain types of muscular dystrophy can also affect the heart muscles, leading to cardiac problems such as cardiomyopathy or arrhythmias. It is important to note that the symptoms and their severity can vary widely depending on the specific type of muscular dystrophy. Some types may present in childhood, while others may not become apparent until adulthood. And additionally, the rate of progression can also vary. Take note of that. So, there are several types of muscular dystrophy, each with its own unique characteristic and pattern of muscle weakness. Here are some of the most common types. The first one is the Duchenne muscular dystrophy. This is the most common and severe form of muscular dystrophy, primarily affecting boys. The mutation occurs in the dystrophin gene located on the X chromosome. This gene provides instruction for the production of the dystrophin protein, which is crucial for maintaining the structural integrity of muscle fibers. Those individuals with this disease, the absence or reduced production of dystrophin leads to the progressive degeneration and weakening muscle fibers. Without dystrophin, the muscle fibers are unable to withstand the normal stress and strain of muscle contraction. This results in repeated cycles of muscle damage and repair, leading to the replacement of muscle tissue with fibrous and fatty connective tissue. Duchenne muscular dystrophy typically begins in early childhood. Over time, the muscles become weaker and less functional, affecting the mobility and causing difficulties in performing everyday activities. It is kind of frustrating to those people who have this because, as you can see, they cannot perform their daily activities, which make them feel sometimes useless. Let's proceed to the second one, Baker muscular dystrophy. Baker muscular dystrophy is a milder form of Duchenne muscular dystrophy caused by mutation in the same dystrophin gene. However, in BMD, the mutation do not completely eliminate the production of dystrophy. Instead, they result in the production of a shortened or partially functional dystrophin protein. This altered protein can still provide some structural support to the muscle fibers, leading to a slower progression of muscle weakness compared to Duchenne muscular dystrophy. Symptoms usually appear in adolescence or early adulthood and progress more slowly than DMD. The third one is Lyme girdle muscular dystrophy. This group of muscular dystrophies affects the muscles around the hips and shoulders. There are several subtypes of LGMD, each caused by different genetic mutation. One common subtype of LGMD called LGMD2A is caused by mutation in the CAP-N3 gene, which encodes a protein called calpain-3. Calpain-3 is involved in the breakdown of damaged proteins in muscle cells, and it also plays a role in muscle repair and regeneration. Mutations in the CAP-N3 gene lead to a deficiency or dysfunction of calpain-3, resulting in the accumulation of damaged protein and impaired muscle generation. Over time, this leads to a muscle weakness and wasting. Symptoms usually begin in the late childhood or early adulthood and progress slowly. LGMD can vary in severity and can affect both males and females. The fourth one is facioscapulohumeral muscular dystrophy. FSHD is characterized by weakness and wasting of the muscles in the face, shoulders, and upper arms. It is caused by a genetic mutation that leads to the abnormal expression of the DUX4 genes. Symptoms typically appear in adolescence or early adulthood and progress slowly. FSGD can vary in severity and affect both males and females. So lastly, myotonic dystrophy. Myotonic dystrophy is the most common form of adult onset muscular dystrophy. It is caused by a mutation in the DMPK or CNBP genes, resulting in prolonged muscle contraction, which means myotonia, and muscle weakness. Myotonic dystrophy can affect various body systems, including the muscles, heart, eyes, and brain. There are two different types of myotonic dystrophy, the type 1 and type 2. The type 1 tends to be more severe and is more common than type 2. The type 2 has similar symptoms to type 1. And also, type 2 causes weakness in muscles close to joints such as proximal muscles, like in the shoulders and hips. Someone with type 2 might experience facial weakness and myotonia. It is the difficulty relaxing the muscles is usually mild or not experienced at all. So, these are just a few examples of the many types of muscular dystrophy. Each type has its own specific genetic cause, age of onset, pattern of muscle weakness, and rate of progression. While there is currently no cure for muscular dystrophy, various treatment approaches aim to manage symptoms, slow disease progression, and improve quality of life for those affected individuals. In this episode, we will discuss some of the treatment approaches used in muscular dystrophy, supported by relevant sources. The first one is physical therapy. Physical therapy plays a crucial role in managing muscular dystrophy. It focuses on maintaining muscle strength, flexibility, and range of motion. Regular exercise tailored to an individual's abilities can help delay muscle degeneration and improve overall physical function. The second one is respiratory support. As muscular dystrophy progresses, respiratory muscles become weaker, leading to breathing difficulties. Respiratory support measures such as non-invasive ventilation or mechanical ventilation may be necessary to maintain adequate oxygenation and prevent respiratory complications. The third one is medication. Several medications are used in the management of muscular dystrophy, although they do not provide a cure. For example, corticosteroids such as prednisone and deflazacort are commonly prescribed to slow disease progression and improve muscle strength in TMD and BMD. Part 1 is genetic therapies. With advancement in genetic research, new treatment approaches targeting the underlying genetic mutation responsible for muscular dystrophy are being developed. Gene therapy, which involves introducing a functional copy of the defective gene into affected cells, holds promise for treating muscular dystrophy. Recent studies, such as the one by Mendel, have shown significant improvement in muscle function and dystrophin production in individuals with DMD treated with gene therapy. Lastly, supportive care. Supportive care measures aim to manage the complication associated with muscular dystrophy and improve the quality of life. This may include orthopedic interventions such as braces or surgery to address skeletal deformities and improve mobility. Additionally, nutritional support, psychological counseling, and social support services play a crucial role in managing the emotional and social aspect of living with muscular dystrophy. It is important to note that treatment approaches may vary depending on the specific type and severity of muscular dystrophy. Therefore, a multidisciplinary approach involving various healthcare professionals, including neurologists, physiotherapists, respiratory therapists, and genetic counselors, is essential to tailor treatment plans to individual needs. So that's all for this video, and thank you for listening.